Good morning, Supervisors. I wanted to start off with a public health report from Dr. Santora.
Okay. Good morning, Supervisors. It's been a week. We've been very busy this week. We are probably today will approach, but I expect exceed more than 50 cases of confirmed COVID-19 among Marin County residents. And I just want to caution people, I think people are closely following our case counts, but I think that's a gross underestimate of the activity of COVID-19 in our community. If you just do some math and with the realization that we are testing those only with moderate illness or those who are hospitalized, which we have seen globally reflects probably just 20% of the population, and that there's 80% that have a mild disease, and that just with the limitations of our testing capacity right now, I think it's very reasonable to expect that probably closer to 3,000 individuals in Marin County, or closer to 1% of our population, are becoming infected or developing COVID-19, which to me, I hope that people can see why, with not just to track our reported cases, but to think holistically about how viruses are transmitted in the community and to see how this will be changing in the days and weeks to come. Yeah. We are still, when many people have seen that epidemic curve, and it's a 12-week curve, and we really are still at week 2 and not at the top, which is that week 6 moment. So where Italy is approaching right now, or if not already at that week 6 of their epidemic curve. So we still have a long way to go. We have instituted orders and will be reinforcing orders today around the closure of parks and open space. We do want to encourage residents to be able to visit their local park by walking or biking. Getting outside and communing with nature is something healthy, and we don't want to discourage that. But unfortunately, we saw over the weekend, not just in Marin County, but across the state and across the world, how cooped up people just throng to their favorite destinations, which places us all at risk. In my head and for my family, I really see it as cocooning. We want to create a cocoon of our closest family members and friends, and that means really limiting contact. It's not just staying 6 feet away. It's really only having contact for essential purposes. So in my family cocoon, it's my 2 parents, my husband and myself and my 2 children. And we try to protect that cocoon. My husband and I are both essential workers, so we are the ones that are most likely to be out in the community and bringing back the infection into our home and our family. And so I think that's another reason why it's so important for our community to follow these orders and to limit all non-essential travel and to limit congregation and social interactions and protect their cocoons, because there's so many among us, including law enforcement officers, firefighters, first responders, healthcare workers, and other essential workers that do not have the ability to stay at home and work from home. They have to be out in our community serving and keeping our families healthy and safe and keeping our hospitals open. So everything our community can do and reducing the amount of times they go to the grocery market and the small things and staying at home and watching Netflix, those are all things that protect the community at large who has to be out there. We are not going to eliminate COVID-19. It's going to be part of our ecosystem, and we'll expect to see it reduce, hopefully across the end of the spring. But we should expect to have spikes happening throughout the summer and also another resurgence in the fall. This is a new bug in our community, and we have to learn how to live with it. Our challenge now is that we don't have all the tools that we have with flu. I do think it one day will be close to that very bad flu season one day, but we don't have Tamiflu, we don't have a flu vaccine, and we don't have a rapid flu test. So our system needs time to build these tools in order to make sure we can keep our community healthy and safe as we learn to adapt to this new virus in our community. So thank you.